Now we look at another abbreviation in chemical pathology. It's quite popular. You see this in different other subjects too, just like microbiology too. So this is what is known as the AIDS. It's quite an abbreviation. It's popular. This is like HIV that has gone advanced. Okay. So AIDS, acquired immunodeficiency syndrome. So let's just throw some light on it before later on we'll talk about different lab tests you use in diagnosing this disease as we are actually focused on chemical pathology. So acquired immunodeficiency syndrome, you should know that what is an advanced stage of HIV infection. Like it's HIV infection that has gone ahead. Do you understand? So your immune system is so weak and it leaves the body vulnerable to what? Any other infection that could just hit you. Your immune system is weak, so any infection could hit you. So usually there's no cure, and well, if you are sticking to your drugs, you know, you can. That's antiretroviral therapies. You can live long. So AIDS is caused by HIV. You know, so normally you have HIV is becoming acute, is becoming chronic, and then you're having the AIDS coming up. Okay, so HIV gradually destroy your CD4 T cells. These are the cells that should normally what improve your immune system. So as the cells are going down, you're having a weak immune system, and there's possibilities of you being infected with whatsoever. You know, so different from HIV is HIV is a virus. AIDS is the stage, the final stage of the disease. That when somebody reach, we're now saying, okay, we're losing this person in any time soon. You know, so symptoms and stages, you have the early HIV, and I don't know if okay, this is just a normal picture, but if I explain, you guys can know it's just this picture. You can pause to observe. So you have the early one where you have all those fever, rashes, sore throat, swollen lymph nodes, not anything serious. It gets chronic. Normally, no symptoms even. Yes, the virus goes down and keep destroying. They'll have the A stage where what it has destroyed too much. This is where the symptoms hit you all of a sudden. Night sweat, fever, weight loss, chronic diarrhea, tuberculosis, pneumonia, cryptococcal meningitis. You can even have cancer, Kaposi sarcoma, lymphoma, invasive cervical cancer. Guy, everything hits you at that stage because you don't have any defense system. So transmission usually spread through blood, through sperm, that's through all those sexually transmitted infections, vaginal fluids, rectal fluids for people that practice anal sex, breast milk too. That's why a woman that is, HIV positive, when you give birth, you have to be on crazy medication and even your child. So common routes is all those unprotected sex, sharing needles, unsafe blood transfusions. A mother could spread it to the child if she's not on her drugs. Then during childbirth, you have all those, blood and there's blood mixture, and also breastfeeding. It's not spread through hugging, through kissing, through sharing foods, through insect bites, and casual contact. So this should actually reduce the stigmatization, right? So what are the things that you can be doing that will make it very, easy for HIV to get to you? If you have unprotected sex or anal sex, you know, if you have other sexually transmitted infections, if you share contaminated needles or syringes, if you do all those unsafe medical procedures or transfusions, also mother to child transmission, right? So they diagnose you using all those rapid antibody tests, ELISA, Western blot, PCR. So those are the things that I will dwell on later on, in chemical pathologies. So that's what we got. Treatment is around antiretroviral therapies, which we won't talk about them much here. But I have a channel on pharmacology. We dwell so much on that. Under the antiviral drugs, we also make a place that will talk about the anti retroviral drugs. So You can be on antiretroviral drugs to the extent that you be what? You to you. You be undetectable, untransmittable. Like your HIV, this will be suppressed to a level that you have it, but you can't send it to another person. Okay? So stick to your drugs if you have this.